Hello, everyone. I'm Professor Lawrence Field. I'm at the University of Texas, San Antonio now. Previously, I've been at the University of Missouri, Stanford University, University of California, San Francisco. So this is my fourth university academic appointment, of which I'm proud. So this is specially prepared for members of the South African Society of Mohs Surgery. I'm approaching 91, and I'm the oldest living person that was with Dr. Mohs. And that started after I came back as a Marine reservist for Korea. I was World War II and then Korea, and when I got back and went to the University of Wisconsin, I got a job. That job was to be Dr. Mohs' assistant. So I was assistant for several years in Madison, Wisconsin. It was a difficult time for Frederick Mohs, who started in the 1930s with a theory in his mind of microscopically controlled excisions of cancer. Now, surgeons ruled the world in those days, the non-intellectual world. Remember, there were just surgeons, there were barbers originally. Remember doctors' histories. So surgeons ruled, and they ruled all the operating rooms. It was not possible for someone who didn't have surgical training to go into a surgery room. So this one gentleman who was an intern, perhaps he had a surgical internship, nobody even knows. But he was not a surgeon, he wasn't a dermatologist. He was a generalist who had a thought about microscopic control. He worked all his life to prove his concepts true and accepted. And now, of course, with the formation of the Mohs College of Micrographic Surgery, which was in 1990, something I think that's established in the world and is the premier method of cancer removal in specific groups of cancers. Not all cancers. All dermatologists can take out cancers, or should be so trained. The training has varied and evolved as the years have gone on, and dermatologists are now the most sophisticated group in their fellowships to handle skin cancers. The most sophisticated group, the highest cure rate, the most beautiful results, and the specialty in my country where most people with cancers go. Used to be surgeons, then it was plastic surgeons. Now it is dermatologic surgeons or dermatologists. Wise dermatologists refer to trained dermatologic surgeons when they have difficult cases. So Dr. Mohs' principles have evolved over the years when he had conflicts, for instance, with Dr. Karari, who was at the University of Wisconsin. In the Korean conflict, a blood expander for plasma expander was evolved. And Dr. Karari, he was a peacock surgeon, thought he would get the Nobel Prize for this brilliant discovery of his, which saved thousands of lives. Today, the world doesn't remember that surgeon. It remembers little Fred Mohs, who the surgeon used to say, "There goes that crazy Fred Mohs," as he walked down the halls. So Fred was very shy, very insecure, always attacked, but he was always right and fought all his life for acceptance of that. And I forget the year, but in 1990 something, he received the highest award from the Academy of Dermatology for his work in cancer work. Not as a dermatologist, because he wasn't, but he had the special honorary award from the Academy of Dermatology. Never got an award from surgeons. So your careers are delineated. There are many books now written. None of them will mention Dr. Anthony Karari, who said, "There goes that crazy Fred Mohs." But nobody ever heard of him anymore. He's gone. So those of you who pursue this, You must be experts in dermatologic oncology. I personally had a fellowship at Stanford University in dermatopathology, emphasizing dermato-oncology, and that's one of the secrets of really being an excellent Mohs surgeon, is to know microscopic surgery, and that's where we have the great advantage over surgeons. None of them are trained in dermatopathology. All dermatologists are, but some of us in dermato-oncology. So I think with that, I'll leave you with my good luck and Godspeed. It's a wonderful, fascinating thing. All my life in my office, I had a cryostat. I followed Dr. Mohs' principles. My patients were happy. Dermatologists were my primary referral group to me. They came from all over the Western U.S. because nobody else did it. And as soon as they did, that was fine. But all my life, they came to my office under local anesthesia. They were cleared of their cancer, reconstructed, photographed, and sent home with instructions to their primary care physician or dermatologist what sutures to remove, when, with photographs, and call me free of charge if there's any problem. Free of charge. Patients who had recurrences, which happens rarely, for me in my office, I charge for the sterile trays, but not my surgery. And that's a clue for you. That leaves happy patients. They're happy to pay for the materials you use, but if you didn't get it all and you said you would, then you must make it good. Good luck. Bye-bye.